Good morning. My name is Lauren Whitehead. I'm from the Auburn University Graduate School of Nursing, and I'm going to talk to you this morning about epistaxis. So epistaxis is also known as a nosebleed. It's severe bleeding from the nose, nasal cavity, or nasopharynx caused by trauma or spontaneous rupture of the superficial veins and or arteries. It's usually located on the anterior superior portion of the nasal septum, known as Little's area or Plesselbach's plexus. So you can see it right here. It's basically an area where there's a lot of arteries that feeds into it. You got your anterior posterior ethmoid arteries, your sphenopalatine artery, your greater palatine artery, and your superior labial artery. This is classified as a symptom rather than a disease. It's most common in children less than 15 years of age and adults greater than 50 years of age. So the cause or contributing factors, one of the main reasons is it's idiopathic, meaning of unknown origin. It just happens, occurs naturally. But some more typical reasons are nose picking, aplastic anemias, leukemias, hereditary coagulopathies, decreased platelet and clotting functions, nasal congestion, sinus infections and upper respiratory infections, hypertension and liver disease, trauma, dry nasal mucosa in the winter months. So some questions to ask your patients for a diagnosis. Number one, has a child or adult been a habitual nose picker? This question is important because epistaxis is most commonly a result of fingers scratching the nasal mucosa, causing trauma and bleeding of the small arteries and veins. Any recent diagnosis of acute or chronic sinus infections, allergic rhinitis, or upper respiratory infection. Any one of those conditions or the medications prescribed to treat these conditions can cause irritation or drying of the nasal mucosa, leading to a nosebleed. Does the patient abuse alcohol or have any underlying hepatitis or liver disease? Alcohol overuse ultimately damages the liver, causing liver disease or hepatitis. Those alter the clotting cascade, resulting in spontaneous bleeding. A patient with positive hepatitis A, B, or C is also at risk for epistaxis for the same reason. Examination, first off, you're going to need a thorough HPI review of systems and physical exam. The nares would likely contain some dried blood as a result of some bleeding that occurred in those small areas of the nasal cavity. A small amount of dry blood could remain in that cavity from prior bleeds. Nausea. So blood is sometimes swallowed during a nosebleed, which then causes nausea as it settles into the stomach. So sometimes patients will present with some nausea. Hemoptysis. Blood that initially bleeds in the anterior nasal cavity or in the nasopharynx is sometimes swallowed, then soon after is coughed back up. Treatments. Ice packs over the bridge of the nose will help achieve hemostasis, keeping the head and face in an upright position, applying pressure by squeezing the alar nasi, then lift the head forward to prevent the blood from being swallowed. Apply nasal packing in the nasal cavity for anterior bleeds, surgical cauterization or arterial ligation for the intractable bleeds, meaning bleeds that just won't stop. Never tilt the head completely back, as that can lead to aspiration of blood. So these outcomes are all basically geared toward resolving and stopping the nosebleeds presently and in the future. Teaching points. Teach your patients to avoid placing objects in the nose, keeping your fingernails short, manage hypertension, sinus, and upper respiratory infections, lubricate the nares during an upper respiratory infection. A cool mist humidifier in the room at night helps to prevent drying mucous membranes in the dry climates in the winter months and in dry heat. And obviously smoking cessation. If the patient smokes, they should be advised to stop. Thank you very much for listening to my lecture. If you have any other questions, just let me know.